Welcome, everybody, to today's episode of The Lindsay Elmore Show. Today, we are talking all about how to live a happy and productive life as we get older. Menopause is first up on the agenda, and menopause is the permanent cessation of the menses for more than 12 months, and it results from an estrogen deficiency and is not associated with any kind of pathology. The problem is there is a cultural construct around the idea of menopause and around aging that we are no longer as valuable as we once were after we go through menopause. This is simply not true. Menopause is something that happens to all women at some point in their life, with the average woman going through menopause around the age of 51. As I said, most of the symptoms are related to estrogen deficiency. Vasomotor symptoms such as hot flashes are predicted to occur within approximately 75% of women. 60% of women experience urogenital symptoms such as vaginal atrophy, urethral atrophy, and sexual dysfunction. There are also psychogenic symptoms that can happen, with 45% of women experiencing psychogenic symptoms such as anger and irritability, anxiety and tension, depression, sleep disturbances, etc. But there's a subset of women who simply ease their way through menopause. If you think about it, if only 45% of women experience loss of concentration and 60% experience that stress incontinence and the frequency and the urgency, and only 75% of women experience hot flashes or migraine, there's a subset of women who glide through menopause with ease. And today we are going to be talking with two people with very different perspectives on what life can look like after we go through menopause or after our children have left the nest, etc. First up, I will be talking to Dr. Kyrin Dunston about how we can stop the menopause madness and go through menopause with ease. After that, I talk with Dawn Berry, who is a certified life coach who works with empty nesters who helps them to find their identity after their children have moved out. Let's get to the show. Welcome to The Lindsay Elmore Show, a podcast that helps you find fulfillment amidst chaos. On this show, I interview thought leaders, doctors, creatives, spiritual gurus, and game changers who inspire you to pursue your dreams, overcome obstacles, and leave your mark. Leading by example, OBGYN and functional medicine expert Dr. Kyrin Dunston lost a life-changing 100 pounds and healed herself from chronic disease by addressing the root causes of her issues naturally. Dr. Kieran has been featured on numerous podcasts and summits, as well as on NBC, Fox, Great Day Washington, Reader's Digest, The Huffington Post, First for Women, Best Self, and many, many more. She is the host of the Stop the Menopause Madness Summit, where top experts share their strategies for attendees that help them to lose weight, regain energy, balance their mood, feel sexy, and master midlife. Guess what? I am actually one of those experts, and I share two different ways with essential oils as well as with nutrients that you can master menopause. She is also the author of the Cracking the Bikini Code, 6 Secrets to Permanent Weight Loss Success, which details her all-natural program for successful weight loss. Dr. Kieran hosts the Her Brilliant Health Revolution podcast and the Her Brilliant Health Secrets YouTube channel, which gives women the knowledge, tools, and support they need to take control of their health and heal, but also to go one step further and to thrive throughout their life. Dr. Kyrin Dunston, welcome to the Lindsay Elmore Show.
Thank you so much, Dr. Lindsay. So happy to be here.
I am so excited to talk to you because I think that we have a major problem in this country and around the world that a lot of people consider that when a woman is beyond her childbearing years, that she is somehow less of a woman, less valuable. Women can perceive that when their period stops, that they lose a piece of their femininity. But you throw all of that out the window and you really help women to do what you call stop the menopause madness, because I think there is also a falsehood that menopause has to be a pain in the butt, that it has to have hot flashes, that it has to have vaginal dryness, that it has to have weight gain, all of these things. So what led you to being interested in helping women thrive? And what do we need to do to stop all of this craziness surrounding menopause?
So what led me to really focus in on menopause is the fact that as I was entering menopause, my health was in the toilet. And was obese. I had chronic fatigue and fibromyalgia. I had depression, anxiety. My hair was falling out. I had no sex drive. I had gastrointestinal problems like irritable bowel and gastritis. I was a mess.
Yeah.
And here I was an OBGYN, supposed to know more about women's health than anyone else in America. And yet I couldn't figure out what was wrong with me and how to fix it, nor could my internist. And I had tried everything in my toolbox that I knew to get myself healthy. And of course, the weight was my number one concern because everyone could see that, right?
Yeah.
This is true for the women I work with. It's always about the weight, even though there's all this other craziness going on. And then when I discovered functional medicine and I used it to heal myself, not by starving myself, not by exercising like crazy. In fact, calorie counting was not a part of that, nor was exercise because I had severe adrenal fatigue. But when I uncovered the root causes and imbalances and I treated them naturally with vitamins, minerals, herbs, botanicals, lifestyle change, the weight just started coming off. I finally gave up on the weight and just said, okay, I just want to feel better and be healthy. And when I did that and I went for the root causes, the weight came off. So I am very passionate about helping women in the perimenopause, before menopause, and menopause, because that's my own story. And I think that we as menopausal and perimenopausal women are very underserved by mainstream medicine.
Yes, yes.
This is why we OBGYNs who are functionally trained and we have the answers, we are all out here telling women what they need to know to regain their vitality. So that's kind of my story and why I'm passionate about menopause. And then the menopause madness is really the madness that you're not getting answers at your doctor's office that you need in order to thrive and be vital and alive. Women are being told, oh, you're tired, that's normal for your age. Women say to me all the time, I don't care if I ever have sex again. Their doctors are telling them, oh, that's normal for your age. And we're being given pharmaceuticals for very remediable symptoms when they're appropriately treated. But most women are leaving their doctor's office in their 40s and 50s with a fist full of prescriptions, a sleeping pill, an antidepressant, sometimes a GERD medicine or irritable bowel medicine, sometimes a birth control pill, but just this bevy of prescriptions that are like slapping Band-Aids all over her, none of which address the root causes of why she's having these problems. So the madness is exactly that.
Oh, I could not agree with all of this more. I think about, I have a friend who just had a heart attack. And I think back to like the treatment guidelines for heart attack. You walk into the hospital and you are fed this terrible diet and you don't have anyone sit you down and be like, hey, I want you to really go plant-based for the next 6 weeks. But instead you're walking out with aspirin, a statin, an ACE inhibitor, a beta blocker, oftentimes another antiplatelet medicine. It just goes on. And instead of somebody taking a step back and saying, we have the ability to actually look at why you had the heart attack in the first place. So talk to us, what happens during menopause? What are the sex hormone changes that occur during midlife? How can women understand this is what is physically going on in your body? And how can we address them so that women don't end up meeting those dead ends and walking out with a ton of medications?
Right. So there are the sex hormone imbalances that occur, but part of the madness is that that's not the only thing that's happening. So it's not the only thing that needs to be addressed, but it's probably the most important. Mm-hmm. So with your 3 female sex hormones, estrogen, progesterone, testosterone, yes, men and women, we have all 3. Mm-hmm. It's just that men have 10 times the testosterone and women have 10 times the estrogen, but we each need all of these. So what's happening is that most of the estrogen and progesterone is produced in the ovary. And you're born with all the eggs you're ever going to have, millions of them. But each month when you hit puberty, most of us will mature 1 egg, and that produces our estrogen and progesterone for the month. So, but many thousands of eggs disintegrate with every cycle. So by the time you hit 35, we are what we call advanced maternal age, because our eggs are considered quote unquote old and they don't function as well.
Thanks.
We just have kind of a remnant in our egg basket. So what happens is by 35 or 40, the eggs that are kicked out every month make way more estrogen and not enough progesterone. And this progresses throughout the 40s. So why is this a problem? It's a problem because estrogen is the weight gain, water retention, PMS, I don't feel good hormone. Mm-hmm. You need enough of it. It's also the Goldilocks hormone, but not too much, not too little, just right. Right. So as it's going up, women will feel bloated and start gaining weight. They'll have an increased risk for breast cancer, endometriosis, uterine fibroids, endometrial cancer. And then the progesterone is going down. Why is this a problem? Because progesterone is the weight loss diuretic, anti-PMS, anti-anxiety, anti-depression, feel good, happy hormone that helps you sleep well.
Yeah.
So you have this divergence happening. And this is where women start saying, I feel like my body hit a dumpster trash fire, because everything starts going off the rails. And by the time you hit menopause, average age of 51 in the United States, your ability to produce these hormones goes down way significantly. There are other tissues that can make these, but they're not in the levels that you're used to having when you're a menstruating female. So most people feel pretty terrible. And then there's testosterone. That can go either way. Half of your testosterone's made in the ovary and half in the adrenal glands. So we'll see about 50% of women will be testosterone deficient, which can occur in the 20s or the 30s. Or the 40s or 50s. So that has to be measured. But testosterone is your mojo hormone. So if you have a deficiency, you're probably not going to feel like you have so much initiative. You can be depressed. You can be anxious. You don't have your get up and go. You can start losing muscle mass and losing bone mass. So you really need all 3 of these hormones. So this is what's happening in the perimenopause and menopause with the sex hormones. And so the madness is we're not addressing that, but also that there are other imbalances that are occurring that are really ignored. And we can get into that if you'd like to.
So you mentioned the adrenal glands, and I know a lot of our listeners get very concerned about wearing out their adrenal glands, having adrenal fatigue, and cortisol has to play a role in menopause. And I think the stress surrounding menopause, it must make it worse. So what is the role of our stress hormones in menopausal symptoms?
Right. So that's that other part that no one's paying attention to is the cortisol, the stress hormone. And the role is huge because in a lot of countries where they don't have the cortisol problems that we have in our country, they don't even have a word for menopause. I believe it's Japan. They don't have a word because women just sail through it with ease because they don't have these cortisol problems. So it's the cortisol dysfunction that causes what's called a pathological menopause, meaning it just takes over your life. So in mainstream medicine, cortisol is really ignored as a factor that determines your overall well-being. But nothing could be further from the truth of what's determining your health level. So cortisol determines your sleep-wake cycle. It determines your energy level. It determines your weight. It determines your immune function, whether you get sick or not, whether you get cancer or not. So I call it Queen Cortisol. It's in charge of almost everything. You can't live without it. If someone came and took all your cortisol, you would immediately die. And yet, who here listening has ever had their doctor talk to them about cortisol or check it? Probably none. Crickets, right?
Right.
That's what I did when I was a traditional OBGYN because that's what I was taught.
And I mean, and I think about it as a pharmacist. If my patient doesn't have Addison's disease, I am not even, it's not even on my radar of like, hey, we've got to push these doses of steroids or this patient is going to die. I actually had a patient who almost died because comes in, has a surgery, no one flipping asks a pharmacist for help. They didn't adjust his steroid medicines to help prevent the Addison's disease symptoms, and the patient almost died. So you're so right. Nobody is talking about cortisol in traditional allopathic medicine.
So true, unless you're in that top 2.5% with Cushing's disease or you're in the bottom 2.5% with Addison's, it's totally ignored because you're told it's very rare, people don't have this, and so it's rare. But the problem is that this is the key indicator of your health, the main determinant. And so this is really the biggest part of the menopause madness because no one's talking about cortisol except you and me and a few other people.
Naturally minded people like to think about our stress hormones, but it doesn't get addressed in allopathic medicine.
Right. And so women really need to know that this is an issue. They need to know that they need to get their cortisol checked, whether they get a spot check fasting AM cortisol. Just tell your primary care physician, I want it. And if they say, well, you don't need that, just tell them, yeah, but I just want it, right? Because you're the boss of your healthcare. Yes. And you should be. And if you don't get it, then you need to find a doctor who listens to you. And better yet is to get a salivary 4-point cortisol, which you can find online and just pay for it yourself without a doctor's prescription. And you want to collect saliva in a little tube morning, noon, afternoon, and midnight. And you'll get back a nice little curve that's telling you what your cortisol is doing. And there's no adult in the United States in 2020 who does not have a cortisol dysfunction. It's not if, it's a matter of how much, to what degree. And so there are different stages. You might be someone who's way high, right? I've had a patient once and she came back and she was at the upper limits of normal on all 4. Well, I call that the superwoman phase. She's got energy for days, go, go, go. I'm only sleeping 4 hours a night. I can take care of the, kids and take care of my husband and do my job. And it's go, 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 because your body's mobilizing all its resources. But then after a while, your body can't keep that up. So the levels start dropping and they don't drop evenly. And this is where you'll see people low in the morning and they're just hitting the snooze button. I don't want to get out of bed. I'm so tired. I can't get up. And then maybe they reach their stride around 12 o'clock noon and they're going. And then 7 o'clock, oh, they're so tired. But then when it's time to go to bed, they can't go to sleep or they're waking up in the middle of the night. And then the final stage is just the flat line, which is what I was when I first discovered salivary cortisol, and that's adrenal fatigue. And wherever you are in that dysfunction, if you're not normal with your cortisol, you're going to have a disruption in your major life indicators and how you feel. You are going to feel bad, regardless of whether menopause or perimenopausal. So the problem is that most of us are accruing these cortisol disruptions in our 20s and 30s. We're living life large, right? Doing our careers, moms, wives, right? We're just doing it. And we might notice, oh, we're a little more tired, so we drink a little more coffee. We have ways we get by that we don't even consider abnormal because they're so socially normal: eating sugar, eating coffee. And then here comes the menopausal, perimenopausal hormone changes we talked about. And we blame everything on it. And we say, oh, it's perimenopause, it's menopause. But hey, this insanity is your cortisol has a problem no one's talking about. And then here comes final menopause, and everyone says, you go to your doctor and they're like, oh, it's menopause. It's normal for your age. But hey, no one's paying attention to your cortisol or the other hormones, thyroid and insulin, which are often disrupted as well.
So what do you think is broken with the way that we approach perimenopause and menopause? We mentioned just masking medications, but what steps can our listeners actually take to help them have a better menopause? Maybe checking our cortisol levels, making sure that we have our sex steroids in line, finding a physician that listens to you. What else is broken and how do we fix it?
Right. So really, we need to stop abdicating our healthcare to our healthcare providers. So I don't blame them because that's how they were trained. That's how I was trained. They are doing a great job for what they were trained for. Do I want a doctor and drugs and surgery when I need it? You bet I do, right? Do I want an emergency room if I break my leg or have a heart attack? I do. Nobody surpasses the United States when it comes to our medical care in emergency situations.
Yep.
But when it comes to chronic diseases and chronic symptoms like menopausal and perimenopausal symptoms, we've got to take the power back and recognize that they just weren't trained. I mean, if I, as a board certified OBGYN, could not figure out what was wrong myself or with my internist, and the tests that I had just said everything was fine or normal, quote unquote, then, you got to hear that, because that means you've got to go to body school and you have to educate yourself with Dr. Lindsay's podcast and my podcast and all the health experts out there educating you about this. So you need to know that you need to get your cortisol checked. You need to know about salivary cortisol assessment, and you need to know about getting your sex hormones checked, because blood testing can check it. Even if your doctor agrees to it, they're not going to know necessarily how to read it. So you want to look to people like me and Dr. Lindsay to know how to properly read your lab test, because I'm telling you, what the lab says is quote unquote normal, or the reference range, includes the 60% of us who are overweight or obese, right? We're not optimally healthy. That's how those reference ranges are created in our country. You want to use optimal values, which generally are in the upper quartiles of that normal range, but it can vary. So you definitely want to find someone who can help you with this. And there are a lot of us out there online teaching you. And then once you have these, you also want to know the right thyroid test to do. There are 8 of them. You want to have all of them done, and you want them to have them evaluated properly for optimal function, not normal function. And you want to look at your insulin hormone. And then you need to know how to assess them. And then if you're needing replacement, are there some botanicals that can help you in the perimenopause? Sure, right? Black cohosh, dong quai, chaste tree. These are some great nutraceuticals that can help you. But once your ovaries have no more eggs and no more ability to make any estrogen or progesterone, there really isn't a plant that's going to get you back to your 20-year-old hormone levels. And is that okay? Well, women ask me, well, do I have to take hormones? How long do I have to take them? Well, if you don't want the benefits of those sex hormones, then you don't have to take them. But you're going to have to suffer the consequences of not having them. So what are they? And you got to think about, what do I want 80 to look like? So these sex hormones have receptors all over the body, predominantly in your central nervous system, your precious brain that operates all of this gorgeousness. People are at increased risk for dementia and Alzheimer's when they do not have adequate levels of sex hormones, estrogen, progesterone, testosterone. So sure, you don't have to take them, is what I say. But if you want to preserve your brain, that's a key ingredient to that. And most women, once they're educated like that and they're not hearing that at their doctor's office, they say, heck yeah, I want that. Heck yeah, right? It preserves the tissue in the vagina and bladder and urethra, the pelvic floor muscles, your clitoris, where you have orgasm and sexual function. So them telling you, oh, it's normal for your age that you don't want to have sex and you have a hard time having an orgasm or you can't have one at all. Sure, it's normal if you have hormonal impoverishment. But if you want to have normal sexual function, you might want to consider bioidentical hormones. Also, bladder leakage is common. Vaginal dryness, thinning, atrophy. My cousin called me recently. She said, Kieran, you didn't tell me that my vagina could cave in menopause. I just came from the gynecologist. She told me I'm in menopause and my vagina could cave in. And I said, oh, well, I think what she means is atrophy and that the vagina actually will shrink. So I can tell a woman's age if I'm going to do her pap smear without ever looking at her face or looking at her chart. If I just go with the speculum and look at her vulva and look at her vagina, I can tell her age. I once had a patient who was 104. I couldn't even get a speculum in. She had never had any hormone replacement, had gone through menopause at 50. No hormones. So that's what happened. That tissue becomes thin. It starts shriveling and shrinking down so that I could see an opening, but you couldn't get anything in it. Well, this is what happens to your vagina. So no, you don't need hormones if you don't care if you have a vagina and a functional clitoris. So, I mean, I hate to be that blunt. No, I don't, because that's how I am. I'm from New York, but.
Well, and we also need to normalize talking about body parts. You know, it is, I'm a pharmacist, you're a physician. Like, we should be able to say vulva and clitoris and vagina without having to hesitate. It's a thing. And I think it creates healthier relationships with our bodies. And I also, I'm no sex educator, but I also think that when children are exposed to normal terms about their body, it allows them to be more conversant. And if a child can tell you, like, Mom, my vulva hurts, that helps you to understand what's going on versus like not having the words to frame it up. So let's talk about hormone replacement therapy, because hormone replacement therapy, it's had its ups, it's had its downs. And you mentioned bioidentical hormones, but there are synthetic hormones that women can take. Are there some that are riskier than others? And do you solely advocate for bioidentical hormones, or is there a role for the synthetic hormones as well?
So synthetic hormones are what's made in a laboratory, and they are chemically dissimilar from your natural hormones. So scientists have taken estrogen and progesterone in a lab and they've attached different chemicals to them to make them dissimilar from your natural estrogen and progesterone, because they can't get a patent on natural estrogen and progesterone. And they've done that, and they've put them into birth control pills and hormone replacement so that they can get a patent, because it's very expensive to do the studies to vet your medication to the FDA and get approved. So they have to do that in order to remain solvent and actually produce a product. So I don't blame them. But the problem is that bioidentical means biologically identical. So I think there's a lot of confusion about that. Women will say to me, well, that's natural, right? And I say, yes, but natural means it's normal for what your body naturally makes and sees. But they have this illusion that it grows on a plant. That's not true. These are also made in a lab usually, but they're natural because they are chemically similar or the same to what you have in your body. So that's synthetic versus natural. Now, the problem is that synthetic hormones have been shown in many studies to increase the risk of just the birth control pill. The longer you're on it, if you're on it over 10 years, and the younger you start taking it, it increases your risk of breast cancer. But how many of you out there who have received a oral contraceptive prescription from your doctor were told at that time, this is going to increase your risk of breast cancer? Nobody.
Yeah.
Because they're not telling you that.
Right.
But it does. And then the most common synthetic hormone replacement therapy included equilin, which was horse estrogen, and medroxyprogesterone acetate, which is a progestin, not progesterone, right? So it had been chemically altered. And it used to be given in something called Prem-Pro or Prem-Phase. I think it's still available.
Oh, it's still available. Yeah.
Right. And the problem is that it increased the risk of breast cancer and other diseases. So they abruptly stopped the Women Health Initiative study. I think it was in 2012, because women were getting sick, and then all women went off their hormones. Everybody was confused and afraid of hormones. So I talk to a lot of women and I say, well, you need hormones. And they go, no, because they've had this fear instilled in them. Unfortunately, there are a lot of doctors who have the same emotional response. Mm-hmm. But this is why you got to step back and educate yourself about what we're talking about. Synthetic hormones here, which might be avocados, and natural hormones here, which are peaches. You can't talk about peaches and avocados. They're not even the same.
Yeah.
So when you replace natural hormones, biologically identical, there is no increased risk for breast cancer or other disease. In fact, you reduce the risk. So if you think about it, I always say that I'm the type of physician who educates women to make their own best choice. I'm not the kind of doctor who says, do this because I say. That's gone, right? So if you think about it, when is a woman's natural hormone level the highest? When she's 20, 30 in her fertile years? Well, if those hormones caused cancer, don't you think that breast cancer would be more prevalent in 20 and 30-year-olds, right? It's not. It doesn't increase until the 40-year-old range, when we get that divergence I talked about, estrogen going up, progesterone going down. Estrogen promotes growth in breast tissue. Progesterone balances it out. So it's not until you get this divergence that you get the problem. So if you restore the hormone levels to a healthy balance, then you actually can reduce the risk of disease, and you can also help all of the tissues, your heart tissues, your vascular tissues, your muscles, your bones, all of the tissues in your body that need these hormones to thrive.
So if a woman has decided that bioidentical hormones are right for her, how do you typically use them? How do you determine an appropriate dose? Do you think that pellets are the way to go, or is it creams? Like, how do you decide individualized care plans around hormones?
It's very individualized. It's custom.
Yes.
It's not a dress
as medicine
off the
should
rack.
be.
Right. It's personalized. So we always start with laboratory evaluation and symptom evaluation. And then we look at all of that. And I don't ever just look at someone's hormones. I do see some doctors doing that, and I don't advise it. You've got to look at everything. You've got to look at how someone's detoxifying and what their toxicity level is, because these hormones are a load that needs to be detoxified in the body. And if someone's particularly toxic, or maybe they have some genetic, what we call SNPs or abnormalities, where they can't detoxify properly and their toxic bin is full, and you dump hormones in there and your body can't get rid of them, you're asking for trouble. So it involves looking at the whole person. And then I come up with individual. I will say this, we never give testosterone or estrogen orally. If someone wants to give you those orally, you need to run the other way. They don't know what they're doing, because it causes problems with your clotting factors in your liver and with your liver function, which is your main detoxification station. I call it the sanitation department. So that's one thing. Now, we will give natural progesterone orally, especially if someone has a lot of anxiety or difficulty sleeping, because giving it orally and it goes into the gastrointestinal system, it hits the nerves in a way that it hits your brain and these GABA calming neurotransmitter receptors, so it can be very useful for that. One of the most common dosing methods, and you know this better than anyone, is the transdermal cream. That's custom formulated with the dose. So we look at your levels, we look at how you're detoxifying, where are your symptoms, how much do you need testosterone or not? Do you need estrogen or not? Not everybody does. But only about 15% of people actually have an estrogen deficit because fat tissue makes estrogen. So many of us in the United States have excess fat, so we have excess estrogen. But I find universally all of us are progesterone deficient. And we'll make a custom formulation. It'll be a cream. You usually apply it here. I have people rub it on their inner thighs, various places, never on the breast. So that's one option. So there are troches, which are little kind of
Orally
dissolving,
disintegrating tablets.
yeah, tablets that you stick in between your cheek. That's another way. I've had some people on sublingual drops for various reasons, and I have used the pellets. I use those myself, actually, which I love, but it's never the first thing I go to, because once you put it in, it's in for 5 to 6 months. You can't change the dose. So I usually like to get people established on whatever transdermal or sublingual or troche they're using, and then if they're stabilized, or some people can get saturated. I had one patient recently who had been on the cream so long, and we kept checking her levels, and it was like nothing. So she wasn't absorbing it. And so we decided to try a pellet with her, and night and day. So she did great with that. So many different ways, but it's custom to you.
Absolutely. And I think that is critically important, that medications and medicine, the practice of medicine, the practice of pharmacy should be very custom. And I'm really grateful for the bioidentical hormone market, because it has led to a resurgence of pharmacists that are practicing compounding, which is what pharmacists do so well. We make drugs very, very, very effectively, and we can make them to where it's very specific for the patient in front of us. And it's not just a one size fits all bullet. And so talk to us more about toxicity and toxic loads, because you mentioned that if you're taking your hormones by mouth, that it messes up your ability to detoxify, and that if you have a particularly high toxic load, it makes you less likely to be able to manage all of these hormones. What can our listeners look out for to know that their detoxification processes are broken?
Yeah, great question. So I like to use something called a MSQ, multi-symptom questionnaire, which has a bunch of symptoms and they're scored. And if you're having whatever symptoms, you check those boxes and you add up all the numbers, and it gives you a score from 0 to 100. And that's a good ballpark. So it's things like dark circles under the eyes, ringing in the ears, puffiness in your face or in your hands. So swelling is a common sign of toxicity. So it's just a laundry of chronic nasal stuffiness, gastrointestinal problems. It runs the gamut. And then once we do that, it really gives a good indicator. So I encourage everyone to do that. And there are some indices that I'll kind of check an inflammatory load on lab work to see how inflamed is this person, because inflammation equals toxicity. They're really kind of one and the same.
Yep.
There are specific tests we can do to check, well, how much of these types of heavy metals do you have? We all have them. It's just a matter of how much. So that's a particular type. We can look for biologic toxins, like we can look and see if you have mold, or do you have certain parasites in your gut, which 60% of Americans have. So we can really check, do you have these types of viruses, Epstein-Barr virus, what's your titer? We can look at all of these toxins. We can also look at liver function, since it's the main sanitation station, and see how your liver is functioning. And really everyone needs to, I'll say the number one thing with toxicity is, if you are not pooping, you are toxic.
Yes, I know. I host a cleanse called the Clean Slate Cleanse, which is designed to help people optimize their detoxification processes. Why do people join? Because they want to lose weight, but we look at how do we reduce the work that has to go into detoxifying your food. And I ask people, what are you the most afraid of? And they're like, oh, what if I just can't stop pooping? And I'm like, girl, if you can't stop pooping, you are on the right path. You're absolutely on the right path. So I want to ask you kind of a bigger question. And if you were in charge of if you had all the power, what would you do with the American healthcare system?
Oh my gosh. I've actually thought about that, and I don't know. I don't know the answer. I am not an expert on systems and management of healthcare management, right? I'm expert in helping women.
Yeah.
And my views are a little unpopular, but I'm going to say them. I do think we need some type of basic healthcare for everyone.
Everyone. Yes, I agree.
And then, like we have public school, no child left behind. We need no human left behind. There are so many people without health insurance, myself included, right? So I think everyone should have basic minimum health care. And then those who want something higher level, like private school, can pay extra and get a different level of care. It's worked for the school system. And I hear in other countries where they have that two-tiered medical system that it works really well. So that's my solution.
If you had the ability to influence every OBGYN in training right now, what would be the advice, the counsel, the education that you would love to see every healthcare provider that provides healthcare to women understand and really be intrinsic in their approach to patient care?
I love that question, and it's something I've been thinking a lot about. And actually, with this whole, I'm going to come back to that, but just start with this whole conversation we're having around discrimination right now.
Yes.
It speaks directly to the discrimination that's happening against women in the healthcare system. And that needs to stop. It's not acceptable. It's not acceptable that we have valid studies and literature that say there are hormone values for women, and that this is they use it in Europe. They did a study of over 80,000 women. Bioidenticals have been used over there. This discrimination against bioidentical hormones and compounding that occurs. So we say that it's okay to have progesterone compounded for pregnant women, and that's acceptable and accurate. But then the argument is, when it comes to menopausal women, no, it's not accurate. And so it's this politicalization of medicine in a discriminatory way against women. And so all that needs to stop. I do believe that all OBGYNs should be required to be functional medicine trained, because we are the front line when it comes to treating women's health. And this is what the madness is that needs to stop. It particularly comes out with women in the perimenopause and menopause. We deserve to live brilliant health and brilliant lives. And there's no reason that we should just be written off at the age of 40 and 50. It's just normal for your age. It is not normal for your age. There is always a reason you have dysfunction and symptoms. And if you don't know the reason, you haven't asked the right question or done the right test or done the right treatment. And we just need to address it. So I think all OBGYNs should have that training.
And we didn't even touch on differences in infant mortality rates based on race, which is just a whole nother conversation that OBGYNs and midwives and doulas all we need a mirror put in our face to be like, hey guys, this is really happening, and you really can change it when we don't discriminate against women of color when they come in to give birth, and we just won't give them pain medications because, she might be an addict. Well, I'm sorry, the housewife that's got 6 prescriptions for anti-anxiety medicines and maybe a little bit of opioid thrown in here and there is more at risk for these adverse outcomes that we consider just because of the way a person looks, that they are more likely to do these things. And it's all just, it is maddening. It's maddening the way that we have lost track of health in America. And I'm so grateful that you were able to come in today and just really reassure women that your value is not related to your age. Your value is not related to your menstrual cycle. I have an unpopular opinion that a lot of people, young girls listening, your value is not related to your virginity status. You are not less of a woman, or you are not a less desirable woman because you've chosen to have sex. And we need to have honest conversations about all of this. And so I'm grateful that I was able to come and be a part of your Stop the Menopause Madness Summit, which is going to be taking place from November the 2nd to November the 6th. And I'll be telling you more about how you can sign up. So keep listening, everyone. You can also find Dr. Kieran and listen to my episode with her on the Her Brilliant Health Revolution podcast, and check out her YouTube channel. Dr. Kyrin Dunston, it has been an honor to speak with you today. And before I let you go, will you answer some lightning round questions for us?
Absolutely.
What is your number one strength?
Insight.
What is the thing that you struggle with the most?
Consistency.
Oh my God. I know. I did the strength finders. I don't know if you've ever done strength finders. Consistency is my very last strength. It's like, oh, yes. Oh man, I understand those vibes. If you could give some advice to your younger self, what would it be?
It would be, your worth is given. You do not have to earn it. Do what you love and shine your light.
Oh, I love that so much. Your worth is given. You do not have to earn it. What keeps you up at night?
Staying consistent. All the things that I have to do.
All the things. Who has been your greatest inspiration?
Oh my goodness. Well, you know what I'm going to say to that? So one of my grandmothers was a pharmacist, and the other one was a registered nurse.
Love it.
And I draw a lot of strength from them.
Absolutely. Last but not least, God to you is?
The divine that's ever present, out picturing in every human and every plant, every animal, and everything we see.
Oh, you could be a spiritual leader over here. And I also think too, just to echo what you were saying, I think God gives that value, to all of us. We have God-given value, and aren't we grateful for it?
Yes. And everybody listening, just know your value is given. You don't have to earn it, and you can never lose it. It is God-given.
Oh, I love it so much. Everyone, please go check out Dr. Kyrin Dunston at www.kyrindunstonmd.com. Thank you so much for being on the Lindsay Elmore Show.
Thank you so much for having me, Dr. Lindsay.
During and after menopause, many women say that they simply do not feel like themselves. But how would your life change if you had more energy, if your hormones were imbalanced, if your libido and your sexiness was just on point, if you had confidence, if you looked great, if you lost the weight that you had put on and mastered midlife? I'd like to invite you to the Stop the Menopause Madness Summit. If you would like to learn from 53 top menopause experts in the world, including me, you can join the live Stop the Menopause Madness Summit between November the 2nd and November the 6th. All you have to do to register is head to lindsayelmore.com/menopause summit. That's lindsayelmore.com/menopause summit. I will be speaking about essential oils and menopause, as well as key nutrition that we all need to get during menopause. The event is hosted by Dr. Kyrin Dunston herself, who, if you listen to her interview, she is an OBGYN and functional medicine expert and the founder of Her Brilliant Health. She is here to tell you that during menopause and midlife, you can still live a happy, healthy, and well life. Join the Stop the Menopause Madness Summit. Head to lindsayelmore.com/menopause summit. If your last child is all grown up and about to leave home, or maybe if he or she has already moved out, you may be experiencing some mixed emotions. Empty nest syndrome isn't exactly a clinical diagnosis. However, it is a phenomenon that happens when parents experience feelings of sadness and loss when their last child leaves home. Although you are ready for your child to go out into the world and you're actively encouraging your children to become independent, the experience of actually letting them go can be exquisitely painful. You might find it difficult to suddenly have no children at home who need your care. You might miss being a part of your children's daily lives, and especially as a single parent, you may simply miss having the constant companionship. You might worry about your children's safety and whether or not they'll be able to care for themselves. You might struggle with the transition if your last child leaves home a little bit earlier than what you had expected, or, oh dear Lord, or if they're still there at age 30 and you're like, okay, it's time to get on out of the nest. If you have one child who, come on, let's face it, is your favorite, you may struggle even more when they leave. Or if you strongly identify as a parent, as part of your validity in life, this can make it much more challenging when your children leave. So, sometimes people need a little bit of help during this time. Today, I'm going to interview Dawn Berry. She's a life coach who works with empty nesters who are desperately trying to find their own personal identity after their children have left the home. If you didn't do it before they left home, it is time to do it now. Why is Dawn so passionate about this? Well, her daughter moved out years ago, and she had a difficult adjustment period as she settled into her new life. So now she works and reaches out to people, encouraging them to find their confidence, their empowerment, and their alignment in their new reality as being on their own for the first time in years. So Dawn, thank you so much for being on the Lindsay Elmore Show.
Thank you, Lindsay. It's great to be here.
I am so excited to talk to you today. So tell us what went on in your life when your children left home?
Well, I had one daughter, so it was empty nest syndrome personified because it had been only us for 15 years. And when she moved out, I made one of the biggest mistakes and went on dating sites to try and fill the void. And it wasn't until after I really started to focus on myself that it was like, these dating sites aren't working. There's something that's not clicking. And until I really found out who I was and what I valued, I couldn't move forward comfortably.
Mm-hmm. Okay, so, we talk about empty nest syndrome, and it's not a true diagnosis, but what emotions did you experience when your daughter left home?
It was almost like a disempowerment because I was so used to doing everything for our family. Like everything I had done was for our family. And once she moved out, it was like, okay, now what? What am I going to do? Who am I? And I really started to focus in on the self-help books and stuff. And it was curious because I started to identify with a lot of the feelings, the grief that isn't necessarily full-fledged grief because there's nothing to close. And then there was the loneliness. And it wasn't full-blown depression, but it was a lack of purpose almost that were the hardest ones.
So, do you think that a lot of parents completely pour their identity into their children? And do you think that was part of your problem? Or do you think that, you said yourself, like you done so much for your family over the years. And so how do parents, even before their children leave, start to really foster and own their own self-identity?
I think one of the biggest parts is actually figuring out who you are separate from the parent role. And a lot of people don't look at that because, okay, they got pregnant, they're in a family, that's who you identify with. So it's really challenging to take a step back and actually figure out who you are and what you enjoy outside of the parent role.
Mm-hmm. Mm-hmm. So what have been some of your biggest, all right, I want to take one step back. You mentioned that you made the biggest mistake, which is getting on dating sites. Why do you find dating sites so detrimental for empty nesters?
Because if you really don't know who you are before you get into these sites, it's really challenging to try and figure out who is going to be a match for you. And there's certain dating sites and they just, okay, well, this is a good match and this is a good match and this is a good match. And you go on dates and a failed date just hits your self-esteem like right in the gut. And you truly can't connect with somebody if you don't know who you are.
Mm-hmm. Mm-hmm. I agree. And I hate dating. I never date. Like I know lots of girlfriends that they are like, oh yeah, I'm going on a date with this guy and with that guy. I can't stand it. I am either in a relationship or not, because I'm one of those people that makes snap decisions. I either love you or can't stand you. And so I can only imagine in that moment of vulnerability when you're already feeling like, oh my God, I don't know who I am. I don't know where I stand. And now you're lumping onto that the expectations of like, I'm going to meet this person and we're going to fall in love and it's going to be all the things that I want. And yet it doesn't work that way, because most people that you meet, you don't fall in love with, you don't do that. So what are some better coping mechanisms that especially women can have if they have been a single mom, or even if they're in a committed partnership? What are some of the things that people can do when their children leave home that are better coping mechanisms than just, okay, I'm going to go out on a date and I'm going to fall in love and I'm going to get married next year, and having all of those unrealistic expectations?
I think the biggest part is to get down and dirty and figure out who you are before you do anything else. And that can be through self-help books, through meditation, through really connecting with what feels right to you.
Mm-hmm.
Because what feels right to me may not feel right to someone else. So it's an experiment almost to figure out what is going to work best for you. Some people, it might be joining a bunch of groups and getting out there. Other people may not be comfortable with that step yet.
Mm-hmm.
So ideally what you want to do is before the kids leave, start to figure out who it is you are and what you truly want out of life.
Mm-hmm. And what have you seen your clients do to rediscover themselves? You know, I mean, have people gone on like vipassanas where they're not speaking for days on end, or is it more simple? Can they just do things in the day to day that help them to rediscover who they are?
I think it's really important, first of all, to live in the moment. Because a lot of the time you're worrying about, oh, are they going to be okay today? Or what are they doing today? And it's all futuristic. And worry is a senseless thing because you're stressing yourself out over something that hasn't even happened yet. So when you're in the moment and you start really thinking about what it is that you want, you can start your action steps and baby steps. Like, it doesn't have to be, okay, you know, today I'm setting boundaries and I am not doing that ever again. And I'm not doing that ever again. And then all of a sudden your calendar's empty because you've decided you don't want that in your life.
Yeah.
So instead of doing these great big action steps, it's easier to do baby steps. And honestly, all we want to do is move the needle 1% every day. And then at the end of the week, you get to celebrate.
Yeah, I love that. So I love that idea of just moving the needle 1% every day. And so how do you encourage your clients to do that? Just that one step each day?
Well, after each of our sessions, we come up with action steps, and they're client guided. So it's their decision what they figure they can or cannot do. And it's just a matter of encouraging them to do that step every day until it starts to become habit.
Mm-hmm. Mm-hmm. And so when do you encourage your clients to actually seek care? Like, when does like the normal grief of your child leaving home and your role as a parent transitioning actually turn into a clinical depression that actually needs attention?
It's a fine line and it's different with everybody. But when you start seeing the signs, that's when you really start pushing the client to seek medical help or to seek a psychologist or whatever they feel comfortable going to see.
Mm-hmm. Mm-hmm.
And we also do some of the neuro-linguistic programming, which again is visualization, and it can help with depression, but if it continues, that's when they really need to seek professional care.
Yeah. So tell us more about the neuro-linguistic programming.
I love the whole concept of it. It's training your brain to think differently.
Mm-hmm.
And when we start to think differently, we create new pathways in our brain, and it shuts off other pathways. So if you've had a situation where you dread all the time, but you have to continuously do it, there's a way to visualize it being a more positive experience and to start looking forward to it. Even if you're not really looking forward to it, if you continuously tell yourself you're looking forward to it and this is what's going to come out of it, you start to train your brain to not be so negative towards that one aspect.
Mm-hmm.
And a lot of it is language too. Whereas instead of saying, I have to do this, it's more, I get to do this. So you're switching the negative to a more positive, and it really influences how you start to think about things.
So so is it just the way that you talk to yourself, or is it something more?
It's more like there's visualization in it so that you can anchor your feelings, and it's an easier way to get to those feelings once you've got everything in place and started practicing it.
Mm-hmm. And so what have been some of the transitions that your clients have made, changing the way that they visualize, changing the way that they talk to themselves?
That's always the biggest challenge, especially for women, because we've been brought up to, you're always positive, you take care of the house, you take care of the kids, this is what's expected of you. And sometimes it takes a long time to really get through to someone that you don't have to live up to society's expectations. You have to do what you feel is right. And we go through some of the things that actually these people have gone through that they've just looked at as, I had to do it, so I did it. And a lot of the time, these things that you said you had to do are great accomplishments. They just don't give themselves the credit for it.
Thanks so much, Dawn. I appreciate you being here on the Lindsay Elmore Show.
Thank you, Lindsay. It was an honor being here.
The Lindsay Elmore Show is written and produced by me, Lindsay Elmore. Show segments are produced by Sue Procco and Kelsey Lorman. Production design, sound design, and editing is by Jive Media. If you have a question about this or any other episode of the podcast, send us an email to hello@lindsayelmoreshow.com. And hey, since you're still here, take a moment to subscribe, rate, and review this podcast. And while you're at it, go over and follow us on Instagram @Lindsay Elmore Show. This helps us bring the pod to more people.